Welcome to the Unite for Sight chapter training video. Thanks to the hard work and dedication of volunteers like you, Unite for Sight is able to eliminate patient barriers to eye care. Volunteers with Unite for Sight's chapters are referred to as community fellows, and you will work with your local community to connect people with free health coverage programs so that they can receive a complete eye exam by an eye doctor. When you interact with someone while volunteering, you are the face of Unite for Sight, and you represent all of Unite for Sight's volunteers and fellows. This means that it is your responsibility to be professional and to be at your best, both for the sake of the people you are trying to help and for the sake of your fellow volunteers. One of the programs that you'll be involved with is vision screenings. This is a simple method of establishing a baseline to determine a person's visual acuity. It is not a diagnostic tool and is no substitute for an eye exam performed by an eye doctor. Before you begin a vision screening, you must first identify yourself as a Unite for Sight volunteer and as a student. It is absolutely essential that the community members you are screening understand that you are not a medical professional and that you will not and cannot provide any medical tests or any diagnosis or treatment. Once you have identified yourself, the community member must fill out the background information form, which is a form that you should print from the chapter manual. If you are screening a child under the age of 18, the child's parent must sign the Unite for Sight parental consent form, also found in your chapter manual. A child cannot be screened unless the parental consent form is signed. If the community member is illiterate, you may help him or her to fill in the responses. After you're done with the background form, the vision screening begins. Fix the visual acuity screening chart on the wall and use tape to mark off the distance from which the chart will be viewed. Different charts have different distance specifications, so make sure that you are setting the correct distance for the chart that you're using. First, you must make sure that the room you're using is well lit so the community member does not have difficulty seeing the chart due to poor lighting. Then, ask the community member to cover each eye separately by using the palm of the hand, not the fingers. Or they can use a piece of paper to cover the eye. During the screening, one Unite for Sight volunteer should stand near the chart to point to the symbols, letters, or numbers, and the other volunteer should stand with the community member to make sure that he or she is fully covering one eye and standing behind the taped line. If the community member wears eyeglasses for distance vision correction, he or she should take the vision screening while wearing them to determine his or her best corrected visual acuity. Each line on the chart represents a different level of visual acuity. If a person correctly identifies 60% or more of the letters, numbers, or symbols on a given line, they pass that line and you should move on to the next one. A person's visual acuity is determined by finding the smallest possible line on which they can correctly identify more than 60% of the symbols. During the screening, it is very important to provide positive reinforcement and to avoid laughing at or embarrassing the community member if he or she makes mistakes. Remember, you are representing Unite for Sight, and you are there to help the community members to the best of your ability. If you detect a difference between the eyes of 2 lines or more on the vision screening chart, especially if the person being screened is a child, suggest to that child's parents that he or she be taken to an eye doctor for an eye exam as soon as possible. For example, the visual acuity in one eye may be 20/20, while the visual acuity in the other eye might be 20/100. A large difference between the eyes and visual acuity at a young age may be indicative of an eye condition like strabismus or amblyopia. These conditions can lead to a permanent vision loss in one eye if not diagnosed and treated early. The child should receive a complete eye exam and diagnosis by an eye doctor as soon as possible. It is very important that you never offer any kind of diagnosis to a community member. You should urge them to go to an eye doctor for a complete exam and diagnosis, regardless of their visual acuity. Even if a community member demonstrates a visual acuity of 20/20, it is still important for him or her to go to an eye doctor regularly. You should connect every uninsured community member you screen with a free health coverage program, such as those through the American Academy of Ophthalmology and the American Optometric Association. If they already have health insurance, you should encourage them to utilize the resources they have by scheduling an appointment with an eye doctor. Visiting an eye doctor for eye exams with regularity is very important, so it is your responsibility to connect the community members that you meet with one of the available free health coverage programs. First, explain that the information from their background information form indicates that they may qualify for a particular free health coverage program. The American Academy of Ophthalmology and the American Optometric Association programs have 800 numbers that can be dialed in order to reach the representatives. These representatives can help the community member determine eligibility and connect that community member with free care. In order to call the 800 number, the community member should either use the telephone available at the community center where you're located, or you can ask the community member to call using your own cell phone. It is important that they immediately call the phone number so that you know that they've been connected with the free health coverage program. If you simply tell a person to call and expect that they will do it at a later time, they will most likely forget or lose the phone number, and then they will never call to be connected with the free care. You may also try to connect community members with other free programs that provide eye care, such as the Children's Health Insurance Program, Sight for Students, or other free clinics in your local area that may provide eye care. If you are located in Canada, the American programs we just discussed will not be accessible to your community members. You should contact your local health and government resources to check on eligibility for free care in your province. In Canada, those who are under 18 and over 65 are usually eligible for free eye exams. To review, in order to perform a proper visual acuity screening, you must identify yourself as a Unite for Sight volunteer and as a student. Have the community member fill out the Unite for Sight vision screening background form. Ensure that the room is well lit. Properly set up the visual acuity chart and use masking tape to mark a line on the floor at the proper distance. Guide the community member through a screening with a professional attitude and positive reinforcement. Explain the importance of regular eye exams and that it is important to schedule an appointment with an eye doctor in order to prevent blindness or visual impairment. Connect the community member with free health coverage programs for which they are eligible. Never make a diagnosis or provide any other exams or tests. As a Unite for Sight Community Fellow, you are providing an invaluable resource to your community members. You are educating them about the importance of regular eye exams, and if they do not have resources to receive a regular eye exam, you are connecting them with freely available resources so that they might be examined, diagnosed, and treated by an eye doctor. Thank you for watching the Unite for Sight chapter training video. For more volunteer resources, please visit www.uniteforsight.org.